It's a matter of life and death, particularly when it comes to detecting and responding to changes in a resident's health. High staff turnover can also indicate deeper issues within the facility, such as poor management or inadequate working conditions. When staff are unhappy or overworked, it directly affects their ability to provide attentive, compassionate care. Additionally, frequent changes in staff make it difficult for residents to form trusting relationships, which is essential for emotional well-being. Next red flag: infections and mortality rates. The risk of infections in nursing homes cannot be overstated. According to the CDC, infections are common in these facilities, ranging from urinary tract infections to more severe issues like MRSA. These infections can be deadly, especially for residents with weakened immune systems. When visiting a potential facility, observe how staff handle hygiene. Are they washing their hands regularly? Are they taking the necessary precautions to prevent the spread of illness? A lapse in these basic protocols could lead to a catastrophic outbreak, putting all residents at risk. Beyond observing hygiene practices, inquire about the facility's infection control protocols. Are they equipped to handle outbreaks, and do they have a history of effectively managing such situations? Facilities with poor infection control often struggle with recurring outbreaks, putting all residents at heightened risk. Moreover, a lack of proper training among staff can exacerbate these dangers. Number 3. Lack of social enrichment and activities. Isolation is a silent killer in nursing homes. It's not just about providing a place to live. It's about offering a community, a space where residents can interact, engage, and live fulfilling lives. When a facility lacks social enrichment programs, it's a huge red flag. The CDC notes that social isolation can increase the risk of dementia by 50%. Therefore, when evaluating a nursing home, pay close attention to the variety and quality of activities offered. Are there opportunities for outdoor activities? Is there a focus on keeping residents mentally and physically active? A lack of these programs can severely impact the quality of life, leading to quicker cognitive and physical decline. Look for diversity in the types of activities offered, both mental and physical. Programs should cater to different interests and abilities, ensuring that all residents can participate. Regular, varied activities not only stave off boredom, but also help maintain cognitive function and physical health. Facilities that neglect this aspect may contribute to faster mental and physical decline among their residents. The fourth: costs and contracts. Nursing homes can be expensive, and understanding the costs involved is crucial. But more than just the price tag, it's important to scrutinize the contracts offered by these facilities. Are all services covered under the standard fee, or are there hidden costs that could catch you off guard? Will Medicare, Medicaid, or long-term care insurance cover any of these expenses? It's essential to ask these questions upfront and get clear, detailed answers. In some cases, families have been financially drained because they didn't fully understand the terms of the contract. This is a financial red flag that could jeopardize your entire retirement plan. Be cautious of facilities that offer contracts with vague terms or that seem reluctant to discuss costs in detail. It's also wise to ask about policies regarding rate increases and whether there are any additional fees for specialized care. Understanding these financial nuances can prevent unexpected expenses that could drain your savings and potentially lead to difficult decisions about continued care. Red flag number 5: check for complaints and violations. State agencies conduct annual inspections of nursing homes, and these reports are a goldmine of information. Ask to see the latest inspection report and look for any complaints or violations that may have been filed against the facility. It's not just about whether they passed or failed. It's about what issues were identified and how they were addressed. If a facility has a history of complaints, particularly those related to patient care, it's a sign that they may not be providing the level of service you or your loved one deserves. Additionally, take your own observations seriously. Do the residents appear well cared for? Are there any visible signs of neglect, such as bruises or bed sores? Don't just rely on the facility's reports. Conduct your own research by visiting state and federal websites that track nursing home violations. Also, consider speaking with current residents and their families about their experiences. A history of unaddressed complaints or repeated violations is a clear indicator that the facility may not prioritize the well-being of its residents. Number 6. Visit. During mealtime, food is not just sustenance. It's a vital part of quality of life, especially in a nursing home. Visiting a facility during mealtime can give you a good sense of how they handle one of the most important aspects of daily care. Is the dining area clean and inviting? Does the food look appetizing? More importantly, does the kitchen accommodate special dietary needs, and are residents' individual preferences respected? Poor nutrition can lead to a host of health problems, from weakened immune systems to increased fall risks. If the meals seem unappetizing or poorly managed, this is a significant red flag. Take note of how staff interact with residents during meals. Are they patient and attentive or rushed and dismissive? The dining experience is also an indicator of overall resident care. Poorly managed meal times can signal larger issues with staffing and resident attention. Additionally, pay attention to whether residents are encouraged to eat together, fostering a sense of community. And the final red flag? Use of the Medicare Nursing Home Checklist. When touring potential nursing homes, bringing along the Medicare Nursing Home Checklist is essential. This tool can help you systematically evaluate the facility on key criteria such as safety, cleanliness, and resident interaction. The checklist prompts you to ask the right questions and make observations that might otherwise be overlooked. This isn't just a formality. It's a critical step in ensuring that the facility you choose meets your standards. Look for indicators that the staff are engaged with residents, that the environment is clean and well-maintained, and that the facility is fully accessible for those with disabilities. The checklist can also guide you to ask more in-depth questions, such as how the facility handles emergency situations or what their policies are on family involvement in care decisions. Facilities that score well on the checklist typically have robust systems in place for dealing with the complex needs of elderly residents, ensuring both their safety and well-being. Choosing a nursing home is one of the most important decisions you'll make for yourself or a loved one as you approach retirement. By being aware of these red flags, you can better protect your quality of life and ensure that your golden years are spent in comfort and safety. Remember, it's not just about finding a place to live, it's about finding a place where you can truly thrive. Meanwhile, if you found this video helpful, please give it a thumbs up and subscribe to The Smart Retiree for more content like this. We're here to help you navigate the challenges of retirement with confidence and peace of mind.